And the next speaker coming up is going to be more from a bit different area. We're welcoming Ilze Kundziņa, head of Erasmus Mundus program on service design, strategy, and innovations. And Ilze has long experience working in different areas together with public institutions, with governmental institutions, hospitals, and more. So she will give more of a sneak peek of how the innovation is actually happening and what do we see, the struggles and some learnings from this part of the work.
Thank you, Kaita. Does it work, my mic? Yes, good. Okay, so I want to start with a small experiment with you. Please raise the hands for those who trust me or who think that I'm a reliable person. Please raise your hands. Yeah, it's okay to show like this, yes. Because that's what I wanted to see. Because the trust is something what I want to talk about. But as Kaita mentioned, I'm coming from academia. I'm Erasmus Mundus program director in service design strategies and innovations, and we are implementing this program together with Lapland University here in Finland, Estonian Art Academy, and Stockholm School of Economics in Riga. But I'm not working only in academia, I'm also working as service designer, and as Kaita mentioned, health sector is one of these where I'm going into. So, but let's return to trust. Every time I enter the health sector, or my students enter the health sector, or my colleagues, actually we are facing the challenge, and trust is our challenge. How can we, as designers, can gain trust from medical professionals? How can we prove that our methods like design thinking, user research, prototyping, co-creation is something what can improve patients' experience? And we are working according to no harm design principle, and that's a principle which is taken from medicine. And idea is that first duty for us is to not to do harm for anyone. And in design, it means that we are not, staying passive or avoiding any changes. It means that we are stepping backwards, we see whole picture, and we anticipate possible changes and side effects. And then, according to that, we do, and according to that, we also decide about the way we are going. Whether it is prototype or interview or new process, we make sure that when we are exposing people, we are not doing unnecessary risks like emotional or physical damage for the persons with whom we are actually working with. And we know that sometimes our presence can be provoking or disturbing, but we act carefully, and of course we respect. We respect professionals, we respect patients as well. And sometimes this gentle disturbance actually is something what can cause these improvements, even if they are small, but still needed. And then there is another challenge, and these are silos. And in healthcare, we also heard a lot about silos yesterday in the speeches, but silos in healthcare, it's not only, we don't see them only in departments, we see them also in the roles. And as designers, we see that actually working with those ones, like for example nurses, or who are lower in hierarchical level, it's much easier to work and collaborate, and they are more eager to participate in co-creation than those ones who are higher in hierarchy. And it's a good question why it is so. Maybe because in healthcare there is very strong culture of authority, but it ends up with less interest and less interest and also less time in reflection, and also skepticism towards us, outsiders, as we are. And in one co-creation session, one nurse told me that actually they have a lot of ideas how to improve the services, but they don't have any platform to share those ideas, and no one actually listens to them. And this is sad. And the question here is, how can we move forward, and how can we actually break those silos, and how can we gain the trust? And I am suggesting to do some experiments. And here is one experiment I want to show you. With my colleague Stefan Moritz, we did summer school, and we did it with the kids. And our summer school participants were kids 6 to 12 years old. And we worked with small municipal hospital in Kundziņa, a small town in Latvia. And it's the hospital's children's department. So we had one week with kids, and they were entering the hospital and started to ask those childish why questions, like why they are crying, like is it possible for parents to stay with them, is there any playroom there, and so on. Because many actually from those kids they didn't have any experience in hospital before. So what we ended up is it was prototypes, and after those very nice and deep questions what children ask, they also got very nice insights and also ideas how to improve this hospital experience. And they prototyped and also tested, and all those tests were recorded in video, and you will see that their ideas included, for example, interior decorations, which is a small thing, but still important. Also navigation outside, inside hospital. They did some ideas about mascot costumes that parents, for example, could wear to enjoy the time with their kids and also with others in the department, and so on. So I want now Otto to share the video, so I hope it works. So let's see together.
Mom and Anna are home. Mom are very worried because Anna are not feeling good. Mom is checking and Anna has very high temperature. She's calling the hospital and Mom says, Anna has very high temperature. What should I do? Then the hospital says, you should come in here and we can make a quickly checkup. Mom and Anna are driving to the hospital. It's very easy to find the hospital because on the road it's a sign where it's standing where the hospital is. And the hospital is also a friendly sign, so Anna is not so scared. And Mom and Anna are going into the hospital. In the hospital, it's a very cute sign with cute characters. Anna can see paw prints on the floor and is following them to the kids' hospital. The doctors have said that Anna must be checked of a nurse. The nurse say Anna has lost a lot of liquid and she must be on the drip a little bit. The drip is not so scary because it's hanging a little cute character on the drip. Anna seeing at the room are full of photos and pictures of the characters. They are great for the distraction. Mom and Anna are going to check in. Anna is getting a box where she can collect magazines and toys. Mom are getting slippers and also a magazine where are standing all information that she need. Anna
and her mom is going through the corridor, there's some nice music and some pictures that other children have drawn for the nurses.
The room where Mom and Anna should sleep is very nice because Mom can fill in a checklist and choose cushion, and also it's a very nice reading lamp and match shelves. They get a nice big pillow and Anna can choose the room.
When Anna goes to sleep, her mom goes to check out the kitchen, and there's some nice microwaves, wine, snacks, and some comfortable chairs. And there's some parents' tips how to make hospital comfortable.
Jungle room is very special. It's also a playroom, and the moms or dads that has nothing to do can read stories or also take a mascot outfit on them and play with the kids.
Well, when Anna is well again, Anna and her mom goes home.
Mom has get a little set with socks and dots that she can make a little character for Anna. When Anna is leaving the hospital, she getting this little character. It's very good memory. And when they are home, Anna and Mom and Dad are very happy Anna is not sick.
Anna's mom can write down a speech bubble about a hospital, and the speech bubble goes to the kitchen, and then children can draw a painting for the gallery, and then the parents can write down how it was in the hospital.
We're hoping that these ideas are getting the feeling and also the environment in the hospital very much better for all persons. For the kids, we hope it's less scary and also they have a little bit fun. The parents, we hope they have it more comfortable, get that information that they want to have, and also they are very comfortable. The doctors and nurses, I hope they will also like these ideas because they can get a bit help with the healing of the kids from the parents. We hope that these ideas are inspiration and also that these ideas are getting the hospital to be better for all.
Okay, so you saw those very brave and curious and playful ideas what children's designed and also prototyped in this real environment. And since I'm coming from academia, I had the possibility to bring them further. So I brought those children ideas to my students of product design. And this was one of the ideas which you saw. There was this character hanging from the infusion system. So my student, she thought that she wanted to work further with this idea of fear. And she created this toy, which is actually kind of bringing and helping to function as a medical bag, because inside, in the stomach, there is medical container and a pump produced by Philips. And this kind of playful toy can be, in the same time, very practical, but also emotionally sportive, for example, for cancer patients. So this idea, this was first prototype, and this was the last one. She won the Latvian Design Awards. But unfortunately, it never got implemented because, and here comes another challenge what we face in academia. Students are working in academic field, and there is hospitals who don't have time, and they don't have specific role for carrying those innovations further. And we are lacking bridges. We are lacking bridges that can actually work with these innovations and work between academia and the industry. So I want to promote here idea that we need empathy, we need trust, we need those people who can make those bridges. And we don't lack creativity, but we lack those bridges. So let's be the ones who build those bridges. Thank you.